Hello. So what we have here is a practice assessment for Chapter 7. This will put the information that we learned in lecture into play here to help prep you for your assessment project that's coming due, okay? So what you have on the right is the case for our patient, quote unquote patient, and what you see on the left is the sample assessment that I'm going to show you how to fill out. So this will look very similar to the assessment that you're going to fill out for Mrs. S, the case that is under your projects. So let's start. What I have is the nutrition screen assessment form, and I have the information that I filled out in red. Okay, so we have the student name, we don't have a site, and we have the date here. And then patient initials, I just put Mr. M. He is 58, male. I don't have a unit or a room number, so I put NA there. And then we have a diet order of general diet. He is admitted for hip replacement surgery, which occurred on April 28th, and you'll see that right here, okay? Past medical history, when we read through this right here, includes deep vein thrombosis, hypertension, and prediabetes. He is single, that's our social history. We don't have any information about an occupation, so I just put NA there. His height is 71 inches, weight 206, and I got that information here. Just be careful that you're putting the correct weight in because we have an admit weight, which is his current body weight, and then we have a usual body weight of 215. So his current weight would be the 206. We have a blood pressure of 138/80 and a temp of 98.8. The next section is the medication in action. So we're going to list the medication that he's taking, and that is furosemide and Coumadin. If you reference your book on page 175 and 176, or look at the PowerPoints from Chapter 7, you will see that furosemide is used as a diuretic. GI side effects include anorexia, vomiting, diarrhea, and constipation. So I just highlighted those in red. And then this should be in red also. I'm sorry, I forgot to do that. But what our diet instructions are for someone taking furosemide is to increase fluids and increase high potassium foods. The second medication that he's taking is Coumadin, and he is on that as a blood thinner, and I'm going to assume it's because of his history of a deep vein thrombosis. There are no GI side effects that we can see in the book on the chart on page 175 and 176. But we do want to make sure that they are getting consistent vitamin K intake. Recall that Coumadin is a blood thinner, and foods that are high in vitamin K can have a pro-clotting property. So if they're going to eat foods high in vitamin K, like Brussels sprouts, Swiss chard, spinach, they need to assure that they're doing it in a consistent level. Next is our lab data, and we don't have a date for the lab data. And we don't have all of the labs listed here, so we're just going to fill in what we have. We have a level for hemoglobin of 15, which you'll find in the case here. And when you look on page 173 in your text, you will see that 15 for male is normal. Hematocrit is 40, and on page 173 in your text, that means he's just shy of the normal range. So one of the reasons why hematocrit would be low would be a possible iron deficiency. But we don't have a medical diagnosis of iron deficiency. So we don't want to go around and give people a medical diagnosis. That's not our job. That's above our pay grade. So we're going to use that term possible iron deficiency. Okay. Glucose is 112, which is high. And he is diagnosed with prediabetes, so we can put that as the rationale for why it is high. And then finally, prealbumin is 19, and that is normal. So we don't need to write anything here. Okay. This section then outlines what we would recommend for a diet for him. And my recommended diet would be a carb counting diet and a low sodium diet related to the prediabetes and the hypertension. Special instructions include these diet instructions related to the medications that he's taking. So high fluids and potassium, consistent vitamin K. Anything else we want to address? I just put here that he will most likely need diet education before he goes home to help him with that therapeutic diet of carb counting and low sodium and the food-drug interactions. At the bottom of page 1, it asks you to write a note. You don't need to complete this part until we've gotten through the medical charting and chapter